Welcome everyone to another exciting session with the Academy of Source-Based Medicine and another session of Shadowing with the Masters. Um, Today I'm going to talk, we're going to do a dual conversation of acupuncture, but I guess if you're seeing it, I guess it won't be dual, but uh, back to back. But anyways, today I decided to do this famous practitioner that a lot of people know in the West, I think, to some degree, if you're into channels, it's kind of hard not to know him, and that is Wang Ju-yi. Um, and today I chose his treatment of polymyalgia rheumatica. Now, polymyalgia rheumatica isn't exactly autoimmune per se, but it can be used for, I mean, it's still a type of rheumatism. It's basically polymyalgia rheumatica is like all your body hurts kind of thing, you know?
Mm.
So that's a prevalent symptom in most autoimmune, a lot of autoimmune conditions. So I thought it fit. Obviously, often for some autoimmune conditions like RA, the pain is very specific in the joints, right? In little joints. And for more systemic conditions, there is more whole body pain. So there's something to keep in mind. So this is Wang Ju-yi here, palpating the channels. He lived from 1937 to 2017. So actually, he passed away not that long ago, 6 years ago or so. Um, so I was actually when I was a student, able to take some classes with him. Well, not like in person, but more like streaming. And translation by Jason Robertson, I believe, right?
Yep.
Um, so that was cool, and he had a lot of interesting insights. Um, and he will always tell the students uh to ponder, right? So he liked to give discussions on concepts and kind of walk you through his inquiry in certain concepts. For example, one inquiry he talked about that was very interesting was this concept of, I think, if I try to remember correctly, like the now gene, like the brain tendon or something. Um, and how I believe it was that. I
Was
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 like
this
brain
the
something.
was this the one that you said like he was influenced by Tang Song Hai or something like that? I remember you. I thought you told me a while back ago about this.
I don't remember.
Okay. Mhm.
I'm trying to remember what the concept, what I think was now gene and the concept and his usage for aphasia. And then he was talking about it in relationship to Tongli Heart
Five.
5 and Zhao Hai Kidney 6 and its usage for aphasia. And he was kind of linking it to this concept of like the brain tendon or something. So anyways, that kind of, and then what was interesting to me is how he was linking it to Shaoyin, right? So and then his points post-stroke aphasia. So again, heart 5 and kidney 6 combo. But to me, what was interesting wasn't just the point, was kind of like how he got us inquiring about how he inquired about it and how he kind of got into the usage of it. Like heart 5 was the dual point, so kind of helped penetrate into like the blood-brain barrier or something. And then Zhao Hai kind of works on like the yin chow. Obviously, heart 5 also regulates the tongue and stuff like that. But
Mm.
it was kind of like that kind of connection that I found very interesting. And he had all type of concepts like that. Questions that he himself didn't know the answer to, but he'll put them as working clinical inquiries that
Mm.
and he'll posit them to students, which I find very interesting because it was a way to get people thinking and not just feed people protocols. So yeah. So he
Can I
was.
just say? Oh, I was just going to say here's his book in Chinese, but the English book I got. in my final year of acupuncture school as well. And like, you know, there was really nothing like it in literature when it came out, in my opinion, because it was kind of like it was like a textbook, but at the same time, it was almost like this kind of interview, like it was almost like a personal stylized textbook on acupuncture, which they do have in Chinese, but we don't really have anything in like that in English. So it was the first time something like that came on where you could almost like feel his own personal style kind of like breathing through the text. It was really
This
Yeah.
cool.
is his case study book in English or
So well, I think that they're working on a translation on it.
oh,
Um,
good.
They
Yeah.
should. Yeah, it's
so
very good.
Yeah.
yeah, it's very cool. That's the one. He also has a textbook in Chinese and the other one in English. His English one I actually think is better than the Chinese textbook. I think Jason Robertson actually did a superb job on that one.
Wow, nice.
Yeah,
And then he has amazing diagrams too.
yeah. Really, really. It's just when that came out, it was the first time that because I my school was just acupuncture, so I hadn't been really introduced to Shanghan Lun or anything like that when I was studying acupuncture. So you know, getting introduced to the six conformations or layers in that acupuncture style was like, well, hey, this is really, really, really cool. So I really, really enjoyed it. So I'm glad that Ivan is doing this as well.
So yeah, so get his book if you if you can, um, because it sort of did blow my mind when I read it, um, especially his discussion on the channels that I want to talk about. So this a little bit more about him. Famed Beijing doctor, had over 50 years of clinical experience, and I think before he died, he was like classified as like a grandmaster by China himself, right? Um, so he was known for treating a variety of internal medicine diseases with acupuncture with his style, um, which is different than how acupuncture is conceptualized, which is often for pain and uh, maybe some orthopedic conditions, maybe some Bell palsy, a little more tricky, but it's still kind of, but the more skilled you sort of are, I think the more pe people will argue the more internal medicine disease you could treat, um, because there's a difference between treating nausea versus treating the Crohn disease with acupuncture. It's just a little different ball game. Of course, one can make argument there is a lot of complexity to external medicine too, and
Yeah.
of course there is. But for simple pain patterns, often acupuncture, is you don't necessarily need to be crazy skilled to treat, I don't know, some regular back pain. I think anyone trained in a 2-year TCM program can do it to some degree with some success,
Mm.
in a very simple way. But the more complex the patterns become of pain, of course, the more and more specialized you have to become, right? Because back pain, for example, can have many causes.
Mm.
Yeah. He emphasized classical research, channel palpation, the idea of channels being in the interstitial spaces and adapting to pathology by a palpable tissue changes. That means to him, the body adapted in regards to the external environment, and it was reflected in the body terrain. So that's why you will palpate and look for changes. Now, not just always external changes, the body will also reflect internal changes, like prenatal changes in the tissue. So almost like the tissues are malleable uh, to to the to the changes of both the external and internal. The external, I think he will say, uh, the changes will be more acute, more superficial, and then the internal, the changes felt more, the tissue will feel more, just more rooted, those changes. So just a little bit of a differentiation he did. Now for the classical research for number one, now he's not just emphasizing like just the Han classics. He will emphasize like later texts, like Song Dynasty texts, like the Zhenzhou Sishenjing, the classical support in life with acupuncture and acupuncture by Wang Ju-yi. Um, I put that this were translated, but actually others are translated. Which volumes are translated, Michael, again?
All 7 volumes are translated 1, 2, 3 in the first one, and then 4 to 7 in the second one, and that's by the Chinese Medicine Database. Translated by Yue Lu and edited by Lorraine Wilcox.
Yeah. So that's a very cool text, and I heard uh, that he really liked that text to derive even point prescriptions from. Um,
Well, Ivan, I think we were talking about this. This was like one of the first texts that they were talking about palpating tender spots as well, or tender
oh yeah,
points as well. So this is actually one of the first instances. And given how much he liked this text, you could perhaps say that this could have been, just we're hypothesizing here, this could have been a little bit of an influence for him to think, okay, I'm going to start palpating more points and feeling the channels as well.
and I don't remember Wang Zhejiang. I mean, some people I think heard that he wasn't even a clinician himself or something. But either way, I think what Wang
No, no, I
Zhejiang
think he
tried
has
to.
case studies in here, so I think he
Oh,
would
does
be,
he? Okay,
yeah.
okay. But I know he tried to rectify in that text, like a lot of the acupuncture dilemmas of point location and to some degree indications to the best of his ability. And I think Wang Ju-yi really resonated with that approach because Wang Ju-yi was all about trying to find some commonality in the literature and to resolve a lot of questions that he had. And actually, Wang Ju-yi, one important thing that he did is that during the Cultural Revolution and all that, he was actually kind of sent like as a barefoot doctor around the countryside. And that's where he started to notice a lot of these changes because he was treating tons of patients in that time.
Mm.
And that's when he started really kind of honing. And he will say he will stay up late all night reading and then practice in the day. So he was almost like an insomniac at that point, just kind of just, reading and reading and trying to dissect and understand. I think he actually saw way more patients at that time than later in his life. Probably because he didn't want to treat that many patients, obviously. But I still think he probably saw a good amount of patients in his later life. I'm not sure, but not as much as when he was sent by the government to treat, right? Now the third emphasis of his is not chasing after recipes or special points, and also minimal point selection. So he's not really into recipes. Now, there are protocols that Wang Juyi has, but they are always modified and given to pattern diagnosis and pattern diagnosis that ultimately is clarified by channel changes, right? So ultimately, he's still to some degree practicing in the guise of TCM, but to arrive at a pattern diagnosis, he is essentially using palpable changes in the channels. Um, so a little bit different. Other things to know about him, that he was the chairman, professor, and department head for various positions concerned with acupuncture research. So he was a pretty big guy academically as well. Um, so anyways, uh, so he was influenced by this statement in the Suwen or in the Ling Shu, I guess. Influenced by the idea of the 12 Jing Mai, is a quote, right? The 12 jingmai are deeply moving in the spaces of the fen rou, the flesh spaces. Now, to him, that the fen rou zhijian, right? That spaces of the flesh, of the divisions of the flesh is another way to translate that, is kind of where he thought that all the channels are at. And that's what he began to liken to the interstitial spaces. Like this places you're able to palpate that are almost like divisions like partitions in the tissue, right? That's where he thought the channels were at. Yeah.
Can I just say is like then if you think about the like character for like point shui, right? It actually kind of means like a cave or like a opening to something, right? So that kind of
Yeah.
aligns well with what that thought in terms of having this kind of like space, right? Even the
Well,
character
and of
for point.
course, Huang Xiang, that's like his whole argument, right? Is that the most of the points we have are like you should use 分次, which means like basically, you should needle in between muscle partitions as opposed to needling directly into the muscle.
Now, interestingly, I know Wang Ju-yi knew Huang Longshang.
Oh, okay.
Uh,
Huh.
I think they both in Beijing, right?
Yeah, yeah.
Yeah, yeah.
So maybe he got some inspiration from Huang Longshang as well.
Oh, yeah, could be. Yeah.
Um, so this spaces includes crevices between uh between flesh and tendon, flesh and bone, tendon and bone, okay? And one thing about that concept of fence that Will is arguing, and maybe he could clarify more, is I don't know how would you even translate that funds like pricking of the spaces?
Yeah, because fen is just like that 分肉之间. So it's,
Yeah.
yeah.
That's what it means. It's just the abbreviated form, yeah.
Yeah,
So to
yeah.
him, like Huang Longshang, I think from my understanding, you could clarify, Will, is that he's using that to needle into points, or is he actually using that to also needle into the channels? Is Fensa only to the points or to the channels?
The points. Yeah.
The points, yeah.
And then the idea is like, right, that it's this idea of the interstitial spaces connected to the membrane source, and the
Yeah.
membrane source communicates throughout. That's the way that it communicates throughout the body.
Now, interestingly, actually, Wang Ju says things very similar to that,
Oh, okay.
because he says like that interstitial space is where the spleen and the sanjiao connect to each other and exchange these nutrients within capillaries. So to him, it's like that membrane and that flesh is where kind of there's this blood vessel exchange where the whole body gets these nutrients from, right? Uh, which is kind of, we'll talk about that a little more. But anyways, another concept by him that is unique is this idea that I think is interesting is this channel confusion slash chaos caused by excessive treatment. This can be just basically to him, it's just the channels are all confused and disorganized. Like the chi, right? Not the channel themselves, the chi within the channels. And what this was caused by was excessive points, okay? Herbal medicine, taking too many medicines you don't need, and then pharmaceutical drugs, surgery, etc. Anything that is basically too much stimulus to the body, causing physiology to go awry. And sometimes when I read some other clinicians' case studies, and they've been through many other doctors, um, then you could already say there's already some element of channel confusion going on. Why channel confusion is going on, why it's important. So if a patient comes to you and tells you, I've been to this doctor, including alternative medicine doctors, then you already know that their body physiology is really confused because they've been sent too many signals, so the body doesn't even know how to establish homeostasis. Because remember, the body is always seeking some balance, even balance within disease, right? And that's how the body, some of these autoimmune diseases, in my opinion, progress slowly, or even some cancers progress slowly, because the body has found balance even within cancer. But if the body's all confused, then the disease spreads rapidly. Also, nothing helps them anymore because the body has lost that organizational capacity, you know? So I think this is important for Wang Ju-yi concept, even within the realm of herbal medicine, okay?
Can I just say is that I think that's like a really good point because the idea is like if you've seen all these other doctors, right, and you've been getting treatments and you haven't been getting better, then what have the treatments been doing to your body, right?
Exactly.
Because then,
Yeah.
like, you know, you look at like going obviously back to the Shanghai, it's like if you're not getting better, and if you're trying to sweating or you're trying to supplement them and they're not getting better, then it's like, are you, what do you, what how is the body reacting to these, how do you say, like, incorrect treatments?
Yeah.
Yeah, and John Jordan calls that a huaibing, like
Yeah.
a bad disease, or how Andrew Nugent
Corrupted
Head
or something.
translates it.
Yeah.
He translates it like iatrogenic disease almost.
Yep.
I don't think that's the best translation, but it kind of does fit though.
Yeah, it makes a bit of sense.
So anyways, we'll go into treatment of that channel confusion and everything. His treatment's actually quite simple, but we'll get into it. Perspective on rheumatism. So rheumatism for him falls on the disease category of B impediment, with which I think Hepuren and Zhang Jiasan, other physicians talked about, right? So it's nothing crazy new. So he still looks, so that's the disease. Okay, that's the being that he's looking at, the nosological category, which often falls on the domain for him, on the domain of exterior contraction from wind, cold, and damp in particular. So that already tells us that he's going to try to remove exterior pathogen, especially because the pain component is going to be often caused by this exterior contraction or increased. And over time, the stasis from these pathogens transform to heat, and that leads to things like damp heat B. Okay, it's the stasis that leads to this heat, or this heating up of the fluids, damp heat. And that's kind of aligned with the Neijing, that heat is really a response. Some people will argue to wind and cold and damp, right? It's the body's own yang response. And some people even look at like the Shahanlan just from that standpoint of heat as a response. Now, I would argue that in the Neijing, you co-contract heat from the exterior, but it's not as developed as, say, later dynastic thoughts, such as the Wenbing, where you really get this introduction of warm pathogen. Now, Wenbing is an idea in the Han, but one will argue that it's just not as unraveled as later dynastic thoughts. But anyways, there's a lot of argument in that. But most of the time, we could say that the Neijing idea is that heat is a development from wind and cold. I think many people will make that argument. But of course, you could make the opposite argument with this text. He especially emphasized transforming damp as the most important treatment principle in the alleviation of the chronicity of disease and reducing symptoms. Okay. So, which is interesting because some people will emphasize cold and some uh, will emphasize the wind, but a lot of time people will emphasize cold, but he was emphasizing damp. Okay. Um, he also emphasized the idea of the amalgamation of interior and exterior causes to clarify the disease cause and disease mechanism. So it's kind of like trying to understand both from from an axle standpoint, both exterior and interior at the same time, right? Simultaneously. So interior causes of B, he says, are often the root causes, which give one proclivity to exterior affliction. He emphasizes causes such as irregular food and drink, which I'm very guilty of, constitution of emotional impediments, prenatal insufficiency. This is what is seen in treating disease. One must search for the root. Now, let me make a little stamp idea of this irregular food and drink. In the Neijing, they say irregular food and drink specifically almost damages the spleen. Okay. And also, we can say this is important thing to think about, because something that's happening a lot in the West, what health fat? Intermittent fasting. So a lot of people just skip food, which can lead to interior disharmony. Now, I don't necessarily think fasting is the worst thing, but if you're going to fast, you need to have regularity in your fasting. You need to break it almost at the same time. So even if you eat less, there needs to be regularity in it. Just my opinion on that. But most people who fast, they break their food at a regular time. They eat at 6, then at 9. There's no pattern whatsoever. So that's going to lead to uh, susceptibility to exterior contraction. So to him, it's like you can't just treat the pathogen. You have to treat what's causing the proclivity to the constant bombardment of pathogen at the exterior.
Can I just say, I was just going to say one thing where you were talking about, he seems to focus on the damp in terms of the B syndrome. I was wondering whether or not you thought that perhaps maybe that was influenced by his idea of like the spleen controlling those like interstitial spaces or the flows, something like that, because the spleen relating to dampness.
I'm not sure.
Not sure. I just sort of thought when you were saying that, I was like, okay, maybe that's where he's kind of like getting his focus from. And then also with
Well,
regular
yeah.
diet and drink related to the spleen again as well. So it's kind of like there's all these little kinds of like spleen things going on.
Yeah, I mean, he does mention prenatal insufficiency too. But yeah, I don't know. I wouldn't know. Now, I would say though, to him when he talks about the spleen, he doesn't really talk about spleen by itself. He thinks about it as tying. So to him, and tying is spleen and lung. So to him, regulating rhythm is really about regulating tying.
What do you mean
That's
by
why
that
even
rhythm?
like irregular, like this idea of, when the lung governs
直觉,
But yeah,
jijie.
yeah,
Yeah,
yeah.
jijie. But also spleen is set to like this regular food and drink. I need to find that
I
concept.
see. I see what you mean. Yeah,
So anytime
yeah.
there's dysfunction in that life rhythm, I don't know how
Mm,
how way to this interval, jijie, like how will you translate that?
yeah.
yeah.
I like
Renning
rhythm.
Chill has a little bit of a discussion on it, but I can't
S-
remember off the top
circadian
of my head.
cycle.
Like to me, it's like it's interesting when you think about it. Like on the lung, it's almost like because the lung governs the rhythm of the body with every breath, but then it's kind of like maybe like the spleen is then governing it on a like a little bit of a larger cycle about what you eat, which you might eat like 2
Exactly.
or 3 times a day, but it's still that tie-in kind of rhythm of what's coming into your body in terms of regularity.
Exactly. And some people, I don't remember where I heard this from, not from Wang Ju-yi, but it's kind of like if you, for example, are fasting, for example, and you're getting and you feel, oh, I feel all this energy. Well, that energy, where are you getting the energy if it's not from postnatal? You're extracting it from your prenatal,
Oh,
right? You're actually extracting it from your essence that you don't want to extract from. So in a certain way, you are aging yourself. Because the idea from like almost from a Taoist standpoint, or just people that are into nourishing life, the Yangsheng is that you use as much postnatal as possible, so you don't go into your prenatal, right? Um, Kind of like you deposit as much of your check into the bank account, or your family gave you a what's the call that when they
Trust
give you
fund or something.
a trust fund, that you don't waste your trust fund. You kind of are living on your check. So when you kind of retired, or you could just use your trust fund when it's really necessary,
Yeah,
you know?
you don't want to be kind of like, an emergency pops up and it's like, oh no, the trust funds are gone.
Yeah,
You call up mom and
exactly.
dad, they're not there anymore.
Exactly, yeah. So anyway, Wang Juji focused on finding primary channels for diseases. So he's not just looking for a pattern, he's looking, uh, one distinction is the channels that are causing those patterns. It's a little of a nuanced distinction, right? So for him, it's not just, okay, like normal TCM will say, well, uh, dampness encumbering the spleen or spleen chi deficiency. But to him, he says, well, he'll still say that language. He needs to find that the channels themselves are leading to those patterns, right? That's why palpation is such a big thing for him. So if there's no evidence for those channel findings, then he might still think of those patterns, but to him, the channels that have the most notable changes that are aligned with the symptomatology will be primary, right? So there's this evidence that he's finding in the tissues that to base his pattern diagnosis on. So that's a distinction between just modern TCM, which is based often on theoretical point functions. To him, point function is going to be important, but to him, the point functions are going to be regulating tissue changes. So for rheumatism, he will focus on Taiying, Taiyang, and Jueyin. Okay, Taiyang, Taiyang, and Jueyin. It must be noticed that he almost doesn't see that he almost he almost doesn't see the Liu-Jing pairs as different. They are part of the same physiological makeup, and often will choose them in concordance to regulate it in its entirety. So not just foot Taiying, but foot and hand Taiying. Not just foot Jueyin, but hand and foot Jueyin, right? So that's another way that he regulates his protocols often. Besides his treatment of the Ren and Du, which are kind of standalone sometimes, his treatments are always has this pairing of the Liu-Jing, and that's one of the thing about the book that Jason Robertson talked about, which I actually read before I even went into Chinese medicine school, that the first half of the book is all about physiology, not even about his style. So it's all about the Liu-Jing physiology. And so he breaks it down into 6 chapters. The first of that chapter is the chapter in Taiyang. So not about the small intestine, not about the bladder, but about Taiyang. And then he breaks it down into distinction about the physiology of each one. But he always tries to make you see the relationship between the bladder and the small intestine, or what we call in foot Taiyang and hand Taiyang. Right? That's one of the very strong distinction, I would say, of his.
It was really unlike any other book in terms of any other acupuncture book, I'd ever read. It was so
and
cool.
I would still argue that in terms of the discussion of that 6 Jing, there's still not that much in English about that.
Probably the only other one that I can think of the top of my head is like the classical thought or ideas by Guohei Liu, but that's purely like
the foundations of ancient Chinese medicine, right?
Yeah. That, and maybe the classical Chinese medicine, the one that was translated by Sabine Williams, but they look at it from a herbal point of view. There's no one else really looking at it from an acupuncture perspective.
That's true.
Yeah.
And it's actually, as I said, it's very visual, so a lot of people like that. To summarize some of his major viewpoints on the Jinglo, Taiyang is about surface circulation. Taiying is about qi transformation, including water metabolism and nutrient absorption. And Jueyin is about interior circulation and movement of wind. Okay, now this is a very short synopsis, so I recommend reading the discussion of the 6 Jing to get a bigger picture of his physiological synthesis. He also particularly enjoyed implementing theory of kaiheshu, opening, closing, pivot, to explain both tangible tissue changes and also explain certain pathophysiological dynamics. Okay, which is very unique, I think. So rheumatism is based on the Jing he emphasized as issues. Based on the Jing he emphasized, Taiying, Taiyang, and Jueyin, has issues with the opening of the Yang, Taiyang, opening of the Yin, Taiying, and closing of the Yin, Jueyin. This essentially is surface evils, Taiyang, inability to transform the qi dynamic, leading to dampness and wasting, Taiying, and wind with interior blood circulation changes, Jueyin. Okay. So top treatment strategies of his will be confluent points of hand and leg Taiying, Yiling Chuan and Chitsa, spleen or 9 and lung 5 as disinhibiting damp. That's his actually top strategy for all types of diseases.
Right.
But for rheumatism, and he states they can treat counterflow of qi, So they have an effect in assisting the chi mechanism, counterflow, and chaos. He will, not to be confused with channel chaos, okay? This is more just the chi mechanism. He will often choose these 2 points as the beginning point strategy to change the chi dynamic in all types of diseases, even skin diseases. So yeah, so it's almost like the dampness leads to almost this chi counterflow. And that chi counterflow and chaos is what leads to the swelling in the joints. Okay. Um, he also, another strategy is shoestream and UN source points of hand and foot tying to disperse cold. That's small intestine 3, Hoshi, and Jingu, bladder 64. He said can warm yang, disperse cold, and treat whole body swelling. So that's the Taiyang component strategy he'll use. And the Dreyin, he says, is to course wind and attune the spirit, because people who have pain are often, dispirited, grumpy, and that leads to further pain. And often these people, even if you're helping them, they'll stop treatment because their shen is not in a good spirit because of the pain. So sometimes people need to be in a certain spirit to receive treatment. There's even a Suwen Suwen statement that I think Suwen chapter 11 or to 13, one of those, or 12. Suwen 11 to 13, I have to find that. That says if the person, and I'm paraphrasing, if the person refuses treatment, don't treat them. Okay, so or the treatment, if the patient doesn't want the treatment won't work. And that's from the Suwen. That's because, well, first of all, they won't receive treatment, and maybe back then it also, they might, sue you or something, or you'll get beheaded or something. But also, it affects the treatment to some degree. Now this is if they refuse it, not necessarily if they're skeptical. Skepticism, whatever. I'm talking about if they are fully, almost like fully not even want to be there, you know? Like they almost hate being treated. Then to him, it's going to affect the treatment. He
Uh,
believed that wind damp rheumatism, yeah.
Well, I was just going to say, it's like when someone refuses the treatment, like probably their body is going to be, like tense. They're not going to want to be there. And needling someone who doesn't want to be needled, they need to have some form of, like, even if they're in pain, some form of relaxation or relaxed muscles when you're needling. And if someone doesn't want to be there, needling them will just probably make everything worse, right? Like,
Unless you want to give them some or the Mafe-san or something, the Huato's anesthesia power.
okay, yeah.
I think maybe that's why Huato kind of dealt with those patients, just knock them unconscious, right? So wind down rheumatism often begins with manifesting as pain without any fixed place. Okay, that's how pain begins to him. Exterior wind. This is a stage of wind guesting in the surface. Then a disease process ensues over time, it leads to interior wind disturbance. Draining can scour and extinguish the wind, often using the 4 gates to course this whole body wind, both exterior wind and interior wind. He will use points like Daling, Pericardium 7, and Xingjian, Liver 2 to clear drain depressed heat and attune the spirit. Spirit often disturbed due to the pain. He will look for, I didn't really know how to translate this, crisp collaterals and tenderness. I didn't know how to translate that. But I'll
That
just
seems pretty, but toy is usually, that's interesting. Yeah. What do you think that means?
well, I know that he will do visual inspection sometimes,
Mm.
and for this drain, he will be looking for this visible collateral, but I didn't know what this crisp collateral concept was. I don't know.
Yeah, I'm guessing that toy is more like 脆弱, as in, but I'm not sure. I mean, because 脆弱 would be like just susceptible to being broken or something like that.
Okay.
But
So,
but I wonder if it's like just like a spider vessel that looks really sort of almost like hard or rigid or something. It could be easily pricked or something like that.
It could be, yeah.
I mean, sometimes, like, even I'm looking at dictionaries, what now they might even say it can still be like a little bit maybe like tender as well. But then how would you differentiate it from the other one, which is tenderness as well? The other one could be like maybe like I don't know, like a brittle, like whether or not like
Yeah,
you
brittle is
feel
the word.
like
Yeah,
Yeah,
whether or not
brittle.
it's like kind of like quite tight and stuff like that.
I
I
was
don't know.
gonna translate as that was the other word I was gonna translate as brittle, but I didn't know what brittle collaterals meant either.
But
It's
by the collateral he means like a spider vessel, or I mean, what is he talking about in terms of a collateral there?
I think for visible changes that he can see.
Hmm.
So I would think just kind of like the normal, kind of the idea in was this Ling Chu chapter 10, the Jing, you can't see them, and Luo, you could see them.
So like at
Mhm.
ST40, you're seeing like a spider vessel or something like that.
Yeah, it could be.
Okay.
But he's talking about it in Dragon, so I don't know. So maybe I like liver 5 or Naguan.
Hmm. Hmm. You could see that, like oftentimes people at Negua, like at
Yeah.
pericardium, what's it called? Um,
pericardium 6.
yeah,
Yeah,
they'll have that. You could almost call it a brittle vessel that's sort of like popped up over the surface
that's
there.
true. Yeah.
Yeah.
So maybe they're like kind of like even like like superficial kind of like they're like the veins coming up as well. That yeah, interesting. Maybe we can ask Jason Robertson or one of his
Jonathan
students. We can
Chang.
yeah, Jonathan Cheng. Yep. Maybe it'd be interesting to hear what they say.
Yeah, definitely.
So the treatment process of his, you hear the patient main complaint, uh, the disease, you categorize the disease, both kind of often Western medicine, and then you could classify it in Chinese medicine, like he did, like rheumatism B, right? Then his Jinluo examination. Then, so that's just palpation and looking. Um, Differentiation of channels. So then he'll kind of zero into which channels. Then he'll select the channels. Then his point selection. So Wang Ju-yi then combined theories of the 6 gene, the 12 channels, and Zhangfu as primary diagnostic methods. So he will often use 5-phase for point selection. No, he will use some 5-phase for point selection, not a lot. So he wouldn't really use it for diagnosis. But point categories seem to be more his forte. That's how he treated. Uh, but they're always in relationship to his selection of channels and differentiation of channels. One reason you call that you know Wang Ju was almost very pragmatic guy. One time he was asked about, for example, all that heavenly turtle method and all those kind of Taoist acupuncture methods, and he said, uh, you know, that he didn't really find them any clinically that more useful, and one of the arguments was that because at that time he grew up like during the Cultural Revolution, so he kind of didn't like those concepts that were too esoteric either. Like
Oh,
5-phase to him will be a little bit more esoteric. He still used it, but it was almost like he was more tangible. Um, and that's why he's a very tangible guy touching the tissue,
right.
So
I mean, just on that point, like you spoke about him reading the classic of supporting
Lingui Bafa,
acupuncture.
that's what it's called, right?
Yeah.
Yeah, yeah.
You spoke about him like reading the acupuncture text, right? But when you look through also his case study books, he reads like yeah, I think he might read like Ye Tian Shi, this other book called Lei Jiang Jirsai, which was a very famous patent book as well in the 18th century. I think he quotes Zhang Jingyue. So like he's reading all these herbal texts, which
Hmm.
then kind of like and using that to inform his kind of understanding of the diseases and stuff like that. So then when you think about it, it's like, well, maybe he's kind of operating in more of like a herbally oriented acupuncture with the like 6 divisions, which obviously based in the Shanghai Lun as well, right?
Well, he was an herbalist too.
Mm.
Hmm.
But not a Jing Feng herbalist. Like a lot of his
No,
stuff seems
no,
to be
no.
much more Shifeng.
Yeah, I can't really make sense of his formulas, that's true. I'm not really impressed by his formula, that's true. But it worked for him, you know?
Yeah.
So he's actually the case now. 59-year-old female with bilateral shoulder and hip pain for up to 2 years. She went to the acupuncture department clinic of Huguosi Hospital affiliated to the Beijing University of Chinese Medicine in November 2016. And in 2014, Polymyalgia rheumatica was clearly diagnosed in the Department of Rheumatology and Immunology of Peking University First Hospital. She had been taking oral prednisone up to 20 milligrams per day, which is just how they're treating autoimmune diseases. Okay, so the patient was admitted to the Peking First Hospital University in September 2016. Review by the Department of Rheumatology and Immunology showed that the ESR rate was 28 whatever, and the C-reactive protein 3.93. So everything's elevated inflammatory markers. At the time Wang Ju-yi saw her, the patient was currently taking 10 milligrams of prednisone orally once a day. So by the time Wang Ju-yi saw her, there was probably not as much of the acute pain. That's why the 20 milligram was reduced. But 10 milligram is still kind of a chronic use, you know?
Is that kind of what they'll put
Um,
people on just as like kind of like a supporting dose, just to
yeah,
like almost like a prophylactic sort of thing where you wake up, you just take it and hope
yeah.
for the
But it still
best.
has side effects though.
Yeah.
Symptoms, pain in both shoulders and hip joints gradually worsening, gradually appearing pain in both knee joints, mild edema in the limbs, satisfactory appetite, lacking sleep, difficult urinating, dry stool, one movement every 2 days. So there she's constipated, dark tongue, white and greasy coating, especially at the tongue root. Western medicine diagnosis, polymyalgia rheumatica, Chinese medicine diagnosis, B impediment. So just pay attention to how he's doing it because you remember the treatment process. Okay, so first the chief complaint, symptoms, then the disease diagnosis, Chinese Western medicine and Chinese medicine. So I like how he's organizing it. And then the examination of the channels. The patient's face and limbs are obviously edematous, which brought a certain difficulty in examining the channels, he says. The hand and feet tying and Taiyang channels are painful with pressure, and the remaining channels, because of the edema, their crevices narrowed, right? So it's almost like he couldn't really get into those spaces, right? He almost had to push the edema away, and the
Yeah.
circulation of the channel collaterals was unclear. So it's almost like he couldn't even do his method so much with this patient. So he said, consider the patient's tying and Taiyang, considering the patient's tying and Taiyang were abnormal, a needle spleen 9, long 5, spleen 9. Remember that his C pair of
Right.
tying. Hoshi and Jingu, the shoestream and the source point of Taiyang. And then he opened the four gates. At Jingu, he says he used a 25 millimeter by 25 Haugen filiform needle, perpendicular needling into the skin 50 and the rest of the point he used a 25 by 44 millimeter needle into the skin about 25 which is about like an inch. Which I kind of like because he's telling you how deep he's going, you know, so
Mm.
it's very specific. Performing lifting and thrusting hand method, so kind of just pushing the needle up and down to get the chi, and even supplementation and even draining. So that's the rotation. So he's not really right. Attaining the chi. So he's all about attaining the chi. And also often when he will get the chi, he wants the chi to go through the channel. So when he needle long 5, for example, he kind of wanted to radiate down the channel, right? Um, Subsequently, leaving the needles for 30 minutes and treatment of once daily for 5 days. So he would treat pretty frequently.
Can I ask just what does he mean? Can you go back to the previous? What does he mean by circulation of the channel and collaterals was unclear? What does the
Um,
circulation mean there?
I think in this case is because when he's palpating, he's not able to get into the spaces, so he will garner their circulation by the tissue changes.
Oh, I see. Okay. Yeah.
So it's kind of
So yeah.
so swelling he can't even actually get in and palpate where he feels like the channel would be.
Because he always talks about like the channel can deviate, right? It can deviate its position um
Yeah.
in response to disease.
One thing
Yeah, and I
I
think in this case the edema is displacing the channels.
mm,
It's almost like affecting the spaces, so it's almost displacing the channels.
Hmm.
one thing I wondered was also whether he did do any other manipulation for the 30 minutes or was this purely retained. Because sometimes people will tweak them every 5 minutes or something like that. So
I think he
interesting.
would just needle, get the chi, and just leave it.
The other interesting thing is then a
At least
treatment
in this case.
once every 5 days as well is cool.
Yeah, because he's so specific. So I think if he will manipulate it, he will tell you.
Yeah, yeah,
I mean, he's
that
so
makes sense.
specific, even the needle he will use,
Yeah,
size.
yeah. The depths as well.
Yeah. So
He's
I
probably
think,
seen a lot of patients, and going between beds and stuff, so
Yeah,
might not be time.
yeah.
after 3 weeks, the patient was examined and the ESR and CRP you could see reduced, right, from 28 to 22. ESR and the C-reactive reduced from almost 4 to almost 3. The patient felt the joint pain was significantly improved and the sweating of the limb and face improved. The prednisone was reduced to 5 mg once daily. The above-mentioned acupuncture treatment was continued for another 4 weeks, and the pain basically disappeared without affecting basic life. Follow-up visit on February 2017. Comparably to before, the tenderness in the Taiyang channel was significantly reduced. The tenderness in the Taiyang basically disappeared. The swelling of the limbs and face was significantly reduced, and the crevices of the channels now were obvious. Right? Follow-up visit took place 1 month later, and there was no recurrence. So this is his discussion on the case. So here's a little discussion on the case. This patient for a long time resides, he says, in a damp land. The damp evil is severe.
It makes me sound like it's an amusement park or something. Let's go to Damp Land or something.
Probably
It's just like
Shidi, right?
where
Yeah.
everyone there just gets dampness and is sick.
If it's
Yeah.
Shidi, sometimes that literally means like swamp.
Oh, okay.
Yeah.
Mm.
The damp evil severe. One is exterior. So he's basically saying there's going to be two type of damp. One is exterior evil coming from the outside and entering. The second is the spleen losing its healthy transportation, internally engendering damp evil. The Taiyang channel governs dampness. It can disperse and resolve the damp chi of the outside world. It can also fortify the spleen, disinhibit dampness by regulating the water passageways, fortifying transportation and transforming dampness. Therefore, the selection of Taiyang to treat this root disease fully embodies the principle of simultaneously treatment of branch and root. So to him, he garnered that this dampness in this case was both the branch and the root. So him on point dynamics, choosing the 2 points of lung 5 and spleen 9, in one principle is the place where hand and foot Taiyang channel chi coalesces and unites and can adjust the chi of the Taiyang channel. Remember, to him, Taiyang is one channel. The second principle is the 2 points in 5 phase belong to water and can dredge water and liquid amassment and stagnation to transform damp. So he almost uses 5 phase almost to explain some point dynamics. Okay. Separately, Hoshi SI3 is the Shu stream of hand Taiyang and simultaneously is an 8 vessel confluent point penetrating the Dumai. Shu stream, as we said before in other cases, govern body sweat and joint pain. Governing vessel governs the yang of the whole body, having the function of warming yang and dispersing cold. Hence, Hoshi can warm yang and boost qi, dispersing cold to stop pain. Jingu is the source point of foot Taiyang. Yang source points can adjust the movement of qi and blood in the root channel. Jingu can adjust, which is bladder 64, right? Can adjust the metabolism of cold water, giving rise to the function of dispersing cold, swelling. So he thinks the yang source points can treat swelling.
I think probably it's when he says cold water there, I'm guessing he's saying like 太阳寒水, which is
Yeah.
sometimes that's sort of like a shorthand for the urinary bladder.
Okay.
And especially like the metabolic function of the bladder.
The only
Makes
thing I would
sense.
say is if he's thinking of it in terms of like the 6 chi, yeah, it could just be like Taiyang cold water, right? Because that's just
Yeah.
what they call it. So both the small intestine and bladder. But
Yeah.
yeah.
I
But
mean,
that's usually go on.
yeah. No, go ahead.
No, that's a good point by Will, I think, yeah.
Yeah, I mean, he's saying basically that the water is accumulating also because that's why he's needed in like SI3 to kind of warm the yang, right?
Mm.
So there's an element of yang deficiency. At the
Look,
same time, assisted using four gates to unobstruct the qi and blood and stop pain. Adjusting the conditions of the channel and collaterals, alleviating the hormones' harmful effects. Okay, so because to him, the hormones also have an effect on the channels and collaterals terrain. So any drug is going to show up on the channels upon palpation. And to him, those hormones, they show changes in these channels that he says. Oops. Besides the diseases of rheumatism, there's also the added changes from the hormones.
So
So
how
Wang
is he
Ju-yi,
saying that the four gate that's interesting to me. How is he saying that the four gates achieve that effect, especially of the hormone, alleviating the hormone effect?
I think
would that be because they cause like the channel
basically,
confusion, right?
yeah, basically four gates is his method to treat channel confusion.
Oh, I see. Yeah.
So to him, yeah, so he uses them to kind of change the channel confusion dynamic.
Oh, he
And
says it right
often,
under there.
Oh, yeah.
oh yeah, yeah.
Oops.
And so often when he thought of channel confusion, that was his strategy for gates. Like that's his strategy by itself. Before it's almost like his preliminary treatment to start treatment. In
And
this case, I don't think he thought he needed it, but there's some cases where he just uses that. You're gonna say something, Will?
are you going to talk later about how he determines that someone has channel confusion? Or
I think in the book he basically says by the history
oh, okay.
and also by nothing's helping them.
Mm, mm,
I don't think
mm,
there's particular any channel changes upon channel confusion per se. You'll still notice changes, but often since something that he didn't say it, but since he's using for gates, then likely maybe there's drag-in changes.
mhm,
I'm just surmising that, but I don't know. But maybe something that his students maybe know a little more. But I know in his books,
mm.
he mostly talks about a history and that nothing's really helping them. But maybe there's probably something he found. So common palpation findings is tenderness or upon touch, nodules. Let me see if I can make that a little bigger.
Oh.
Crevice narrowing, which we saw,
Mm.
right? Swelling, including swollen lumps, string-like lumps, and deformities, right? Um, so it's almost like people, uh, which I thought was interesting. So if somebody has deformities, yeah, from RA, but maybe even constitutional deformities, like a person's fingers bent at a certain channel, he'll think that's prenatal insufficiency of that channel,
Mm. Mm.
right? Um, he will palpate the fundamental channel, exterior interior related channel, and same name channels. So to him, there's really that root channel that he like spleen, for example, foot tying, exterior interior related channels. So that's like foot tying with foot ming or spleen stomach, and then the same name like foot tying, hand tying. Okay, so they're all related. So really, there's two relationships for him. Okay, so using the observatory palpation methods of these five. Okay, these are the way he diagnoses and palpates. The first is examination, observation of all channels in the surface of body, such as color abnormalities, floating or sunken lomi, distinguishing repletion and vacuity, cold and heat in the entire jinglo, ultimately used to narrow down the culprit afflicted channels. So this is just observation. What I translate as cutting, but
Oh no,
used to
chair just
cut.
is it like because you chair my oh wait, do you chair my or is that a
Yeah,
different
yeah,
yeah, so it
TMI.
just
Yeah,
means
that's
like
the same.
pushing,
Yeah.
pressing, right? You just kind of like
Yeah, but I think he's because he's using it to almost, I guess, cut off and press on artery pulsations. That's why I put cut off to understand the repletion and vacuity, including ringing at the neck, the head corner, stomach A, toe A, kidney 3, above and below navel pulsations, fuyang at the dorsum of the foot. Now I don't know how much he uses, but it mentions it. So which I thought was interesting. So he
Very
was actually
interesting.
using
Yeah.
some of this pulsation. I mean, it makes sense.
Galban. Yeah.
He's palpating the whole body. Why wouldn't he palpating this vessel changes? It made no sense.
Mm.
Um, rubbing, massaging, and pushing the channels on the body surface to check whether they're nodules or core-like masses on the channels, whether masses or pain in the chest or abdomen, and whether they're deformities, tenderness, or changes in the limbs. Also, the rubbing will pertain to, well, if you rub it, for example, long ten is often used to rub in other traditions to diagnose the stomach. And I think it comes from Ling Shu. But you could say other, if you rub the channel and the area is very pale or blood doesn't go, then you could tell vacuity repletion. If you rub
Mm.
right away and there's a bunch of redness, that tells you something, heat stasis. Another method of him is pressing, often done on points, such as the five Benshu points, Yuan and low, ascertaining changes such as painful upon pressure, numbness, fondness, or resistance to pressure, and nodules in those areas. Um, grasping, using palm of the hand to feel the surface of skin temperature and moisture. So it's almost like he's using like this, uh, or I guess like this to feel the surface changes, right? Also using comparing areas of yin and yang by feeling surface changes. So I guess you could do an example like this. If you go like this, you could check what in very if Shaoyang's more hotter than the dragon. That tells you something, or vice versa, right? Let's say you palpate and Neguan, or I mean, Shinbao pericardium channel is hotter than Sanjiao, and the person has a fever. That tells you something. You might say, well, the fever is at the blood layer because pericardium governs the blood, and Sanjiao is more about the qi. So things like that will go into his treatment process because he's all about the mechanism as well by the tissue changes. Anyways, this is basically the last strategies. Pericardium 7 and liver 2, child point to drain repletion. Yin spring to clear heat and resolve depression from qi mechanism, depressed and stagnant. Also, one thing he talks about yin spring points is he likes to use them for yin deficiency heat, which I thought was very
Mm.
interesting.
Mm.
So liver 2 treats like liver yin deficiency heat. Okay, so I thought it was a very unique usage for these yin spring points.
Mm.
Often people will use more like his C points for that, but he
Yeah.
uses this four gates to course external wind and also extinguish internal wind, which we talked about.
Would he
But
combine, sorry, would he combine like a Folio or some Sanyin Jiao or something that's like a in supplementing point with that, or
likely, I didn't. This cases didn't talk about that, but it's
Mm.
likely.
Oh, okay.
Prenatal and postnatal dual treatment were Rheumatica, Sanjiao, and Shenshu. So I just wanted to include that because I talked about that some of the root causes is prenatal. So this is a method that he used. It seems simple, and it is, but it's a method he uses. He directly maxes the back shoe, and that's it.
Mm.
Look, I'm really a big fan of Wang Ju-yi as well. I think when his books came out, it was really just unlike anything else I'd ever read. It was really, really
Oh yeah.
incredible. And really I would say, you know, in terms of like English literature, you should definitely read that one. You know, the Pathomechanism series, Guo Hui Liu as well. They're just great books to read and have. And yeah, I think if you're an acupuncturist and you haven't read his books, you're really, really missing out.
Yeah,
Yeah, I think
definitely
though. Yeah, go ahead.
definitely look out for that case study book too.
Well, yeah,
Because there's nothing like, kind of seeing how he actually applies these ideas, right, in clinic. And that book also it has a lot of discussion after each case study too, which is really cool.
well, hopefully they
Yeah.
translate it like that. But
I'm
it
sure they
would,
will.
yeah,
Yeah.
yeah, it'd be a waste if they didn't, I think.
Yeah.
Well, the discussions often come after the case,
Yeah.
so
Yeah.
it's just part of the text, so they show
Yeah.
them.
Yeah, yeah.
I
All
mean, this
right.
case study, his case discussion comes from the text.
Mm.
Hmm.
One of the
So it'll
things
be
that I
like,
also thought was important to look at in terms of this case as well, and depending where we put it, is like last week or 2 weeks ago we did a case looking at Zhajian Mufangji Tang, which was, and like his diagnosis was just impediment syndrome or B syndrome, right? So when we're looking at these different doctors and how they're diagnosing as well, and once again, I think was this case just like abnormalities in the Tai Yin channel, was it?
yeah,
Um,
basically,
yeah.
basically,
A-
yeah.
And so once again, he's like he's not sitting there thinking, oh, it's excess of spleen, like deficiency of kidney, things like that. He just has this kind of, we've got the disease, and then he finds, okay, there's abnormalities on this channel, so that's what I'm going to treat. And like it kind of cuts through a lot of this murkiness of like 5 Zhang TCM diagnosis, which is good in some instances. But when someone comes in with something like this, okay, is B syndrome, dampness is prevailing. There's changes on the Tai Yin channel. All right, so I'm going to needle these, and there's also perhaps like a little bit of like chaotic chi, so I'll open the 4 gates. Bam, and that just can, I would say still with your cases, you need to do proper diagnosis and things like that. But if you can work in a diagnosis like that gives you a bit of a clearer idea what to do, I think that's a really, really kind of like positive
I
thing, and
mean,
that's what we're trying to highlight.
ultimately his diagnosis was 5 Zang,
Mm.
like but he wouldn't arrive at 5 Zang through the normal inquiry a lot of us learn in TCM school.
Yeah.
Well, yeah, we don't, yeah, I don't know about a normal TCM school, but just this idea of first identifying a disease, right? Which, sometimes we learn, the first thing that you should identify is essentially a pattern in TCM. So, but by first identifying that disease, he's really narrowing down the amount of sort of diagnostic differentiation he has to do.
Yeah, especially after 50 years of experience, right?
Yeah, yeah. But this is also like a Jingui method as well, right? Where you first look at the disease and then you can narrow it down from within there.
Now, one
Very, very
In
last
true.
thing I want
herbalism.
to say, he does have some needling methods that I read that I didn't include to needle directly tissue changes. Like he has a method for nodules, he'll needle the nodule directly.
Mm,
So because to him the nodule is preventing
right.
the channel from flowing
Yep.
correctly. So sometimes people think he's just points, but sometimes he's also about regulating tissue.
Mm.
Um, so it was one thing nuance about him.
But
Anyway,
and that makes a lot of sense. If it's kind of like a little bit of even the chicken and the egg. Did the tissue disharmony come first before the organ, or did the organ cause the tissue disharmony? But in this way, it doesn't matter. You just like by treating the disharmony on the tissue, you're treating both externally and internally the problems, right?
exactly.
Yeah, I
And one
really enjoyed
argument
that.
about Wang Ju-yi, you know, when about the tangible effect of points, because he's needling points and seeing changes in whole channels. So it shows you that points have the systemic effect from
Definitely.
Wang Ju-yi style, you could argue, right?
Well, I even think when you do like if you do acupuncture with like relatively strong dirt chi on some points, they often the dirt chi really tends to stick to the like channel pathways is what I found.
Yeah.
So there's even something kind of to be said whether or not, and you know, like he in his book, like I'm gonna remember this very loosely, but he talks about what could the De Chi effect be, and he says it's something like maybe like the interstitial like water crystals within like the flesh or something like that being changed by the metal. I can't quite remember, but that was his kind of idea about when you feel like the movement of the chi as well, like whether or not is these like interstitial kind of like fluids changing. But I'd
Yeah,
have to
Yeah.
look it up to give a proper
he
quote.
basically believed that all acupuncture research is really gonna go into that Fenrose, you know, into that the any all acupuncture evidence is gonna kind of go into that or something like that.
Man, thank you so much, Ivan. That was a very interesting case, and then like, yeah, I definitely think that Wang Ju-yi will go down as one of the greatest 20th century acupuncturists that we know. Um,
Mm.
I'm looking forward to more of his stuff in English.
Thank
Mm.
you.
Mm.
All right,
Take
we'll
care,
see you
everybody.
guys. We'll see you next time. Bye bye.
Bye bye.